One of the most common complaints that I have gotten in my office over the past 15 to 20 years is the complaint of heartburn along with chest discomfort. Of course, it is critical to be sure that there is no evidence of heart disease. However, most of these patients are younger and in their early 20s or 30s and are almost usually diagnosed as having reflux esophagitis or GERD. The main problem with this disease is the fact that there is really not a valve that holds the stomach acid in the stomach and keeps it from refluxing back into the lower portion of your esophagus, where there's no natural barrier that protects the lining of your esophagus from the stomach acid. This actually causes a chemical burn to the lower portion of your esophagus, which is the reason that most people present with heartburn and pressure in the chest that can actually mimic heart pain or angina. Doctors generally end up prescribing drugs like Prilosec or one of the other proton pump inhibitors like Nexium, Acifex, or Prevacet. These are very potent drugs that significantly decrease the amount of acid you can make. Physicians usually also give practical advice like not eating any large meals, not laying down for 2 to 3 hours after any meal, avoiding things like alcohol, aspirin, Motrin, Aleve, spicy foods, chocolate, or any food that would tend to upset your stomach or cause this heartburn. The main concern with chronic reflux is the fact that over time the lower portion of your esophagus is damaged and you can develop a precancerous lesion called Barrett's esophagus. However, it is also known that this chronic reflux may possibly lead to esophageal cancer. This is why your doctor may recommend that you have a procedure called an EGD, where they pass a scope down into your lower esophagus and stomach through your mouth. Obviously, you are sedated, but your physician is concerned about making sure that you do not have any precancerous or cancerous tumor and that you do not have evidence of an infection called H. pylori that increases your risk of having reflux. Because of these risks, once a patient is started on one of these proton pump inhibitor drugs like Nexium, they usually remain on them for the rest of their lives. What most patients don't realize is the fact that when you try to come off this kind of drug, that there is actually what is referred to as a rebound phenomena, where you begin making more acid than you've ever made in your life. Even if the esophagus is healed, you produce so much acid that your reflux symptoms usually reoccur. This is why I have my patients that I feel have healed their esophagus switch over to a drug like Zantac or Pepcid, which are H2 blockers that don't have this rebound problem, and I have them do this for 2 to 4 weeks before going off everything. Now, these H2 blockers decrease the acid enough to allow my patients time to get out of this rebound cycle of the drug like Nexium and find out if they are symptom-free even after stopping all of their drugs. I have been able to get the majority of my patients off these potent drugs by using this approach. Now, I have noticed for years that my patients with reflux symptoms that start my Healthy for Life program and go on a low glycemic diet that also avoids all breads, flour, cereals, rice, will come into my office a few weeks later telling me that they no longer have any reflux. I have now identified that these individuals have either an intolerance to the high glycemic carbohydrates or to gluten, because as soon as I start them in my maintenance program and add back those grains and bread, their reflux returns. I feel that many people who suffer from reflux symptoms and go on RX's weight management system are going to notice similar improvement. In fact, there was a recent study that was reported in the June 15, 2012 Family Practice News, where 50 patients with significant reflux symptoms were put on an elimination diet for 6 weeks. They avoided the 6 most common food allergens, which were dairy, soy, gluten, eggs, peanuts, and shellfish. 64% of the patients had complete recovery and nearly 80% had significant recovery. Then they added back each food one at a time in order to identify the primary culprit to which they were sensitive. The most common food triggers were gluten 60% of the time, dairy was 50% of the time, followed by soy 10%, nuts 10%, and eggs 5%. Now, if you've had problems with reflux in the past and you want to go on SlenderX and RX's weight management system, I would recommend that you follow this elimination diet approach. In fact, check out last week's Medical Minute for more information on just how to accomplish this goal. You just avoid all these foods along with the high glycemic carbohydrates and stay on a 1,250 calorie diet. You will not only be able to lose weight effectively, which has been shown to help reflux, but you will also be able to determine whether or not you have food allergens that are causing your problem.